Now, the United Nations Special Envoy on Tuberculosis is tearing up efforts to raise awareness on the need to scale the testing and treatment of the disease. VOA's Damisi Fawole reports.
Tuberculosis is the disease that we thought HIV was going to be in the 80s.
Ambassador Eric Goosby says it is important to highlight tuberculosis and its devastating effects on poor populations. TB is an infectious bacterial disease usually affecting the lungs. It is spread through the air from one person to another when an infected individual sneezes, coughs, sings, or speaks. The U.S. Center for Disease Control and Prevention says 9 million people around the world were infected with TB in 2013, and about 1.5 million people worldwide died as a result of TB-related infections. The United Nations Special Envoy on Tuberculosis says TB is a serious problem in sub-Saharan Africa.
There are 24 million people infected with HIV in sub-Saharan Africa, and at least a quarter of them are with active tuberculosis. So you've got a lot of people moving around the sub-Saharan African continent who are carrying active TB.
The CDC reports that without effective treatment, HIV and TB can shorten a person's lifespan. Someone with latent TB infection and untreated HIV is more likely to develop TB than someone without HIV. Goosby identifies universal health coverage as the goal of his campaign. He encourages different communities to get involved in raising awareness about the deadly disease.
What you need is a continued educational component, a continued testing component, and a continued treatment component that becomes seamless in its ability to identify, enter, and retain people in care.
The TB Alliance states that over 4,000 people die daily as a result of the disease. Ambassador Goosby implores that just as the world has fought endlessly against HIV/AIDS, similar efforts are needed in the fight against TB. Health experts say there's great need for more public education on TB, proper medicinal distribution, and communal efforts in raising awareness and combating the negative effects of the disease. Damisi Fawole, VOA News, Washington.